Now let me tell you some of the very important golden points within the general pharmacology. So like we have come to the conclusion of the general pharmacology, in which I am trying to tell you some of the very important points in this particular general pharmacology. Now in this, first you should know what do you mean by the word physiological antagonist. Right, physiological antagonist. So if you see here, physiological antagonist, two drugs having opposite response via action on different receptors, right? They are having opposite response, but they are two drugs and they are not acting on the same receptor, they are acting on the different receptor. So remember, two drugs acting on different receptors with opposite action, they are called as the physiological antagonist. For example, you take adrenaline. Adrenaline causes bronchodilation by action on the beta 2 receptors. That is the physiological antagonist of the histamine, which causes bronchoconstriction by acting on the H1 receptors, right? So two different drugs acting on two different receptors but opposite action. That is what is your physiological antagonist. Now after having discussed about the physiological antagonist, and the other important thing what we have is the pharmacological antagonist. Right, the pharmacological antagonist. Now you see here, two drugs, they have opposite response via action on same receptor. That is what is called as the pharmacological antagonist. So remember here, when the two drugs, they are having opposite response via action on same receptors, they are called as the pharmacological antagonist. And what is the example here? You take propranolol. Propranolol, by acting on beta 1 receptor, it will cause bradycardia, that is, it will reduce the heart rate. It is the pharmacological antagonist of the adrenaline, causing tachycardia by acting on beta 1 receptor. So propranolol will cause bradycardia by acting on beta 1 receptor, whereas adrenaline will cause tachycardia by acting on beta 1 receptor. That means the receptor is same but the action is different. That is what is called as the pharmacological antagonist. Next, now the third golden point, remember here. Now you see here, we have the receptors. You take the alpha 1 receptors. Alpha 1 receptors, they act by increasing the calcium, right? Alpha 1 receptors, they act by increasing the calcium, whereas beta 1 receptors, they act by increasing the cyclic AMP, right? What I am trying to discuss now is, at the end of the general pharmacology, I am trying to discuss the important points in the general pharmacology. Alright, next. Now let me discuss another important golden point. You take the volume of distribution, right? We have discussed about the volume of distribution. Remember, apparent volume of distribution is more than the total body fluids if the drug is sequestered by the tissues. I'll repeat again, apparent volume of distribution is more than total body fluids if the drug is sequestered. That means if the drug enters into the tissues. That is about an important point regarding the volume of distribution. Next we have discussed about what is called as the essential drugs, right? Essential drugs or the essential medicines. Now you take the essential medicines are the drugs that cater to priority healthcare needs of the population. So essential drugs are those drugs that are useful for, or they are used to cater to the priority healthcare needs of a population, and most of these are formulated as the single compounds. That is your essential drugs. Next, let me discuss another important point regarding the G6PD deficiency. Right, G6PD deficiency. See, the important drugs causing hemolysis in a patient with G6PD deficiency are these particular drugs. They include primaquine, sulfonamides, dapsone and methylene blue. So these are the drugs which will cause hemolysis in a patient with G6PD deficiency. Next, after this, another important golden point is we have a clinical trials and as well as their other names. So clinical trials and other names. If you see here, you take phase 0. Phase 0 is your microdosing studies. Phase 1, it is your human pharmacology and safety. Phase 2 clinical trials, they are therapeutic exploratory. Phase 3 clinical trials, they are therapeutic confirmatory. Phase 4 clinical trials, they are post-marketing surveillance. So we have discussed this in detail when we are discussing the clinical trials. Next, the another important golden point is regarding your grapefruit juice. Now, remember the grapefruit juice, it acts as the inhibitor of CYP3A4. Why? Because the grapefruit juice, it contains what is called as furanocoumarins and naringin. So furanocoumarins and naringin, which is present in the grapefruit juice, they act as the inhibitor of CYP3A4 enzyme. Alright. Next we have discussed about what is called as the therapeutic index. Right, we have discussed about what is called as therapeutic index. So therapeutic index, it is a measure of the safety of a drug. Right, therapeutic index, it is a measure of a safety of the drug, and this particular therapeutic index, it is calculated as LD50 by ED50. LD50 stands for lethal dose, ED50 stands for the effective dose. That is what is your therapeutic index. Next, another important golden point is regarding the scheduling of the drugs. That is, schedule H is an important point. Right, schedule H is an important point. So remember here, schedule H of drugs and cosmetics, this particular act, schedule H of drugs and cosmetic act, it deals with drugs that must be sold by retail only when a prescription by registered medical practitioner is produced. Most of the drugs, they fall under this particular schedule, that is schedule H. Next we have discussed about a terminology which is called as efficacy. Right, efficacy. What is efficacy? Efficacy refers to maximum response a drug can produce regardless of its dose. That is what is called as efficacy. Next, now regarding the important adverse effects caused by thalidomide. Right, thalidomide, it will cause a long-term effects. So thalidomide will cause what is called as phocomelia. Right, phocomelia. So remember, phocomelia is a defect in the development of long bones, and it is caused by thalidomide when given to the pregnant females. So that is an important point regarding the thalidomide. Next, now you need to know the drugs which will cause SLE, that is systemic lupus erythematosus. Remember, drugs metabolized by acetylation, that is mainly the slow acetylators, they cause SLE-like syndrome, and the mnemonic is SHIP, that is sulfonamides, hydralazine, isoniazid and procainamide. Alright, next. Now you need to remember a very important drug interaction of rifampicin. Rifampicin is a first line anti-tubercular drug. This rifampicin can result in failure of oral contraceptives due to its enzyme inducing property. Right, rifampicin, it has enzyme inducing property. So due to which this rifampicin can result in the failure of oral contraceptives. Alright, next we have discussed about a terminology that is called as pharmacogenetics. Right, pharmacogenetics. Now what is this pharmacogenetics? Remember, pharmacogenetics refers to study dealing with how variations in human genome affect the response to the drugs. That is what is your pharmacogenetics. Next, later on we have discussed the drugs which follow a zero order kinetics, right? This is a very important multiple choice question. Remember, the drugs which follow the zero order kinetics, they include warfarin, alcohol, high dose aspirin, theophylline, tolbutamide and phenytoin. So these are the drugs which follow the zero order kinetics. Next, and later on we have discussed about the drug dosing. Remember, most accurate method of calculating the drug dosage in children is based on the body surface area. Alright, most accurate method of calculating the drug dosage in children is based on the body surface area. Alright, next. Now later on we have discussed about therapeutic drug monitoring. Okay, so therapeutic drug monitoring. Therapeutic drug monitoring is not required for antihypertensives like ACE inhibitors, and therapeutic drug monitoring is not required for anti-diabetic medications like metformin, and therapeutic drug monitoring is not required for anticoagulants like warfarin. Okay, so that is about your therapeutic drug monitoring. Next, now another important golden point is, like, we have a group of drugs which are microsomal enzyme inhibitors. Okay, so now let me tell you which are the important microsomal enzyme inhibitors. Right, let me tell you which are the important microsomal enzyme inhibitors. The important microsomal enzyme inhibitors are valproate, ketoconazole, cimetidine, macrolides except azithromycin, and the other group ciprofloxacin and protease inhibitors. So all these are your important microsomal enzyme inhibitors. Alright, next. Now we have discussed about what is called as the gastric lavage. Remember, this particular gastric lavage, right, this particular gastric lavage, it is contraindicated in certain poisonings. That is, remember, gastric lavage is contraindicated in corrosive poisoning and kerosene poisoning. That is, in case of corrosive poisoning which is caused by strong acid or strong base, and as well as in case of kerosene poisoning, the gastric lavage is contraindicated. Next we have discussed about what is called as forced alkaline diuresis. Right, forced alkaline diuresis. Forced alkaline diuresis is effective for the management of acidic drug poisoning like phenobarbital, aspirin and methotrexate. Remember this point. Forced alkaline diuresis is effective for the management of acidic drug poisoning like phenobarbital poisoning, aspirin poisoning and methotrexate. So these are some of the very important golden points in the general pharmacology. So this completes the discussion about the general pharmacology.